Healthcare provider gives the green light on physicians recommending medical marijuana. Dr. Mark Breesacker, Intermountain Healthcare's chief physician executive, is here to explain how Intermountain is implementing since the Utah Medical Cannabis Act was passed back in December. So let's explain what happens. You basically tell physicians that you are okay to recommend medical cannabis.
That's correct. We took some time to understand the new law. We took some time to talk to patient advocates, and we also talked a lot to our physicians and really working to understand what does everyone need and how can we all work together. And so we're really pleased to be at this point.
I think on the advocacy end, a big sigh of relief that Intermountain got involved because they didn't think, yes, we had a bill, but how was it going to be implemented? Would there really be a pathway for medicinal marijuana?
Yes, and when you talk to advocates and patients, you understand the journey they've been on, and it really helps you understand where they've been, and it's a compelling story. So we understand the law, we understand the benefits and risks associated with the law, and I think we're at the spot that we need to be at.
And Dr. Breesacker, you are in the pediatrician field, and you have seen medical marijuana work in children.
Yeah, so it has been shown to help for when kids have really bad seizure disorders, and I think anyone who's seen a child have a seizure knows how scary that can be. And so we've seen it help there, and there is a lot to learn about medical cannabis, and so we're looking forward to being part of that as well.
So walk us through a patient who has a qualifying condition. What do they do when they see the doctor?
So they should call their doctor that they have a relationship with, and they should have a conversation around what's best for me given my condition, and do we think together that this could help?
So both parties are in agreement. Then what happens? Is there a portal that this recommendation is filled out? What happens?
So we have built into our electronic health record a letter that meets all the requirements of the law. And so the physician or the nurse practitioner or physician assistant can fill that out. And it comes with some instructions that we give to patients as well. And then we give it to the patient.
And we have to remind folks that it is still illegal to actually buy the medical marijuana, so it's left to the patient to figure out what happens next, because it'll be another year or so before that is in place.
Yes, I think that the fine point there is that at the federal level, it is a Schedule I controlled substance, which means, yes, we're not supposed to use that. But in our research, what we learned is that there has not been any prosecution of a physician.
Because we're not the first state to implement
this. That's right. That's right. We're following others, and there's been an honoring of state law. So the risk isn't zero, but we feel it's low for physicians and nurse practitioners.
As you mentioned, there's so many risks in life. Surgery is one of them.
Yes.
It's not zero, but the risk is low.
That's correct.
Okay, where can people find out more information and their first step?
I think there's a couple of places that I would go to. The first is the Department of Health. I know is developing some information and resources, and of course there are several really good patient advocates groups, Utah Patients Coalition, Truce, and they certainly are able to help people.
Excellent. Dr. Breesacker with Intermountain Healthcare. More information, go to their website, intermountainhealthcare.org.